Okay, good morning, everyone. I am Elizabeth Ramirez, and here with us we have Olivia. Today we're going to be talking about PTSD and adjustment to trauma. So, for PTSD and adjustment to trauma, we have a client named Lucy Gray. Lucy is 30 years old and is currently 8 months pregnant. When Lucy found out she was pregnant, she decided to move in with Michael, who is the father of her baby. After 3 months of living together, Lucy started to see that Michael was becoming more and more hostile towards her and was occasionally becoming violent. There had been warning signs and hostility before, but nothing was as serious as the assault that we're going to talk about. Can often be seen punching holes in the walls, breaking property, or breaking things in the house, and on a couple occasions had pulled Lucy's hair. 4 months ago, Lucy came home from a doctor's appointment and told Michael that the baby was a girl. Michael wanted it to be a boy, so he was very upset by this. He then proceeded to violently assault her, blaming her that it was not the outcome he wanted. This resulted in serious injury. Lucy decided to go to the hospital, and thankfully, the baby was not harmed. But after this event, Lucy was done and she decided to move out of Michael's home. So, for the last 4 months, Lucy has struggled with recurrent dreams of the violence and trouble sleeping. She avoids the area where they used to live and refuses to drive down the street. She has panic attacks from loud noises and coming in close contact with men. She has a fear for the safety of her daughter. She feels like it was all her fault and that she caused Michael's outburst, so she is having some self blame going on there. She barely leaves the house in fear of seeing him again because she does not live far from where they used to live. And lastly, she has reduced interest in her social life and seeing her friends.
So Lucy meets the following DSM-5 criteria. Exposure to a traumatic event. She had a direct experience. Intrusion symptoms, recurrent distressing dreams, physiological reactions to internal or external cues that symbolize an aspect of a traumatic event. Avoidance, there's avoidance of or efforts to avoid external reminders that arouse distressing memories, thoughts, or feelings associated with the traumatic event. There's negative alterations in cognitions and mood associated with traumatic event. She has a persistent negative emotional state, distorted cognitions about cause and consequences of the event, like blaming self, feeling detached and estranged from others. There's marked alterations in arousal and reactivity associated with the traumatic event. She has an exaggerated startle response, sleep disturbances, and the duration of criteria B, C, D, and E is more than 1 month, and her symptoms have been present for 4 months.
So, now we're going to discuss medications that we would or think would be beneficial for Lucy. So, the first one is Paxil. This medication is an SSRI, and a common dosage would be 25 milligrams or 50 milligrams once daily. Some side effects of Paxil are nausea, diarrhea, dry mouth, drowsiness, fatigue, and weight gain. Another medication is Effexor XR, which is extended relief. This is an SNRI, and a common dosage is 37.5 milligrams to 75 milligrams once daily. Some of the side effects are nausea, constipation, headache, nervousness, increased blood pressure, and excessive sweating. The last medication is Prazosin or Minipress. This medication is an alpha blocker. Common dosages are 1 milligram, 2 milligram, or 5 milligrams 2 to 3 times daily. Some side effects are dizziness, drowsiness and tiredness, headache, feeling weak, feeling like the heart is pounding or skipping, having palpitations, or nausea.
So, risk factors and relevant issues for these medications. For Paxil, some risk factors are suicidal ideations or behavior, bleeding disorders, liver impairment, kidney impairment, withdrawal symptoms when stopping, sweating, and sexual dysfunction. Some relevant issues when breastfeeding, Paxil may transfer to breast milk. When pregnant, Paxil can cause birth defects and specifically heart defects in the baby. And when taking other medications, Paxil may cause serotonin syndrome. For Effexor XR, risk factors are hypertension, suicidal ideation, kidney impairment, trichomania or hypomania, headache, dizziness, nausea, dry mouth, and increased blood pressure. When taking other medications, Effexor XR can cause serotonin syndrome, and when pregnant, it can cause neonatal adaptation syndrome. For Prazosin, risk factors include drinking alcohol, being 65 years or older, priapism, eye problems during surgery, and taking other pressure medications. Some relevant issues for pregnant or nursing women using Prazosin during pregnancy, you should use it with caution if the benefits outweigh the risks. It's also excreted in breast milk, so use caution if you're breastfeeding and consult your physician. And there's considerations for older patients. It may cause significant orthostatic hypotension.
So, for our psychotherapy treatment, we decided to discuss cognitive processing therapy, which is a common form of treatment used for those who have PTSD. This form of therapy involves trauma focused cognitive restructuring and developing new perspectives on the traumatic event that the client has gone through. So, for this case, this would be the abuse that Lucy went through. CPT is used to combat the beliefs and distortions that develop after a traumatic event, such as self blame, negative views of oneself, and flashbacks. All of those things Lucy is experiencing. The article below provides an overview of CPT and the core components of it. The author reviews research based on CPT's effectiveness. They discuss randomized controlled trials demonstrating symptoms and how they reduce over time. The article also highlights the diverse population that CPT can work for, such as military veterans, sexual assault survivors, and individuals with complex trauma. Here we have our referral for Lucy. We are referring her for a psychiatric evaluation. So we are reaching out to Dr. Adams. We let her know that we're writing to refer Lucy Gray, who is under the care of us, and we are wanting to get medication management. Based on our observation and the client's reported history, we suspect that she has symptoms consistent with PTSD. Some of the symptoms that Lucy has presented are recurrent dreams, flashbacks, avoidant behavior, sleep disturbances, and panic attacks. This has significantly impacted her daily functioning, behaviors, and well being. So, given the complexity of Lucy's presentation and potential need for pharmacotherapy, we believe that a psychiatric assessment is warranted. Previous interventions have provided limited relief. Attached, we have clinical notes, assessment results, and treatment summaries.
So the double-blind placebo-controlled study on Prazosin in Raynaud's phenomenon. Prazosin, or Minipress, is commonly used to treat high blood pressure, but it can also be known to improve insomnia and nightmares for patients diagnosed with PTSD. This study was on the therapeutic efficacy of Prazosin in 24 people with Raynaud's phenomenon, which is a condition that causes temporary discoloration of the fingers, toes, and other extremities in response to cold temperature or stressful conditions. So the patients took 1 milligram of Prazosin, and those patients displayed moderate improvement and reduction in the daily number of attacks they would have. Finger skin temperature and laser Doppler estimated finger skin blood flow assessed during a standard finger cooling test all revealed a beneficial effect of Prazosin. And the study concluded that there was an overall good response and usefulness of the medication in 2/3 of patients. And our questions are, do you think Lucy could be duly diagnosed with PTSD and adjustment disorder? And number two, what is another possible symptom Lucy could be experiencing due to her clinical case? And three, what other psychotherapy treatments could Lucy benefit from? And these are our references, and that concludes our presentation. Thank y'all for watching.